Is appendicitis a serious condition? The answer is yes. Appendicitis can sometimes be ignored or mistaken for other less serious conditions, especially in its early stages when symptoms might be mild or vague. However, it's crucial to recognize that it is a serious condition that requires immediate medical attention. Appendicitis is an inflammation of the appendix, a small pouch attached to the large intestine. The most common cause is a blockage in the appendix. This is often caused by stool or other substances, including the appendicolith, a hard lump that forms inside your appendix. If left untreated, it can lead to severe complications, such as a burst appendix, which can cause a life-threatening infection called peritonitis. Today, we will discuss the 8 signs and symptoms of appendicitis. Symptoms can vary, but here are some common signs that might indicate the condition is worsening. 1. Abdominal pain. This is usually the first symptom and often starts around the belly button before shifting to the lower right abdomen. The pain often begins as a dull ache in the middle of your abdomen. As the inflammation worsens, the pain typically moves to the lower right side of your abdomen. The pain becomes more intense over time and can be quite severe. Activities like coughing, sneezing, or walking can worsen the pain. 2. Nausea and vomiting. Typically occur after the onset of abdominal pain. The severity can vary from mild discomfort to intense retching. While they can be bothersome, nausea and vomiting are usually not as severe or indicative of the condition as the abdominal pain. 3. Anorexia. People with appendicitis often experience a sudden and significant loss of interest in food. When the appendix becomes inflamed, it sends signals to the brain that disrupt normal bodily functions, including appetite. Anorexia usually occurs early in the course of the illness. You may not feel hungry or have a decreased interest in food. 4. Low-grade fever. As the inflammation worsens, a mild fever may develop. When the appendix becomes inflamed and infected, the body's temperature rises in response to the infection. This usually manifests as a low-grade fever, typically between 99 Fahrenheit and 100.5 Fahrenheit. It's important to note that a higher fever above 101 Fahrenheit might indicate a more severe infection, such as a ruptured appendix. Before we continue, if you think this video is helpful, can you take a moment to like and share it to someone you know who could benefit from it? Also, if you want more health topics like this, you can subscribe and click that notification bell to get updated whenever we upload a new video. 5. Swollen belly. As the appendix becomes inflamed and infected, it swells and becomes increasingly sensitive to touch. The area around the appendix, typically the lower right side of the abdomen, becomes extremely sensitive and painful when pressed. 6. Constipation or diarrhea. The inflammation and irritation caused by the appendix can disrupt normal bowel function. Constipation is more common and often occurs due to the decreased bowel motility caused by the inflammation. While less frequent, it can happen as the body tries to expel the irritating contents of the inflamed appendix. 7. Malaise. Malaise is indeed a common symptom associated with appendicitis. It's that general feeling of unwellness, fatigue, and lack of energy. While it's not always present in every case, it's often a sign that your body is fighting an infection, which is what appendicitis essentially is. 8. Painful urination or difficulty urinating. In some cases, painful urination can happen because the swollen appendix is close to the bladder, which can irritate it and cause discomfort. This irritation might make it hurt to pee or make you feel like you need to go to the bathroom more often. Sometimes the pain can also spread to the pelvic area or cause a bladder infection. If you have these symptoms along with the other symptoms mentioned, it's important to see a doctor right away.